Hi everyone, welcome back to my channel, Nurse Life Balance. Today we're going to be talking about if I think it's worth it to work as a patient care tech while you're in nursing school. For those of you that don't know what a patient care tech is, we also call it a PCT in the hospital. It's a very similar role to a CNA, Certified Nursing Assistant. Your responsibilities as a patient care tech can be anything from bathing patients, ambulating patients, taking vital signs, assisting with feeding if any patients need assistance with that, and assisting with any nursing duties that the nurses on your floor will ask you to complete, as long as it's in your scope of practice and in your scope of experience. Now that you have an idea of what a patient care tech is, I'm gonna tell you guys if I think it's worth it to work as a patient care tech while you're in nursing school. I do think it's worth it if you have the time and ability to work as a PCT while you're in nursing school. It's a really good opportunity to gain experience and just get familiar with the different technology in the hospital and different equipment that you need to use, like the vital sign machines, EKGs. You also get to work with the IV pumps if that's in your scope of practice, working with different equipment like PureWicks, Foley catheters. Another thing that you get to gain experience with, which it might not seem like a big deal, but it is because it's really hard, is transporting patients. Sometimes I have to transport them in their beds with their IV poles and the oxygen tanks, and it takes a lot of practice in order to get your transportation skills up, because maneuvering those beds with a full adult patient in it is not easy. So as a patient care tech, you will get experience with that and you will become familiar with how to do it, which I know it doesn't seem like it's hard, but it is, and you will get used to that because that's the main role at some hospitals of a PCT. Another reason it's a great opportunity to work as a patient care tech while you're in nursing school is because of the network that you can build. You'll be working with multiple nurses. You get to know a lot of people that work in the hospital, and that could just help build your network up to help you in the future if you ever are looking for a position in a certain specialty. Somebody you meet might have a connection for you in an area that you're interested. Having a strong network in healthcare can really take you very far. Not even just in healthcare, in every aspect of life. Who you know really can determine where you end up. And not to say that personal hard work and sacrifice doesn't get you places, because it definitely does, especially in healthcare. You need those qualities as well. But having a strong network can really put you above and beyond in where you're trying to go and what you're trying to accomplish in your career. As a patient care tech, you're going to be working with nurses, respiratory therapists, physical therapists, occupational therapists, nurse practitioners, physician assistants, physicians, and the list goes on. So if you put yourself out there and make those connections, and just simple things like introducing yourself and saying, "It's nice to meet you, how can I help?" that really does put you above, and it can also help you get into specialty units. They might know somebody that works in your desired unit, and they can help recommend you if you have formed a good connection with them. The specific way that I acquired my job as a PCT during nursing school is through something called SNAP program. SNAP stands for Student Nurse Apprentice Program, and this is a way for student nurses to join a hospital and work as a PCT while they're in nursing school, even if they don't have a CNA certification. And this allows them to gain experience and work in a unit. And then once they graduate from their program, they kind of automatically get hired to work on that unit, as long as that's within their contract and as long as things went well while they were working on that unit. Some hospitals will either refer to this as the SNAP program or nurse extern, so you can search for both of those roles while you're looking for a SNAP position. I personally found mine by Googling it online. I believe it was on Indeed. So you can just do a general Google search in your area to see if there's any SNAP programs available, also called nurse extern, depending on the hospital. The cool thing about being a SNAP nurse is that once you start your SNAP position, you work as a PCT role. You work in that scope of practice. But once you graduate your nursing program, you get something called your authorization to test from your university. And this basically means that you have passed their program requirements to sit for the NCLEX and take your boards. Once you're in your SNAP position and you get your ATT, authorization to test, your scope of practice kind of increases a little bit in your job, and you get to start working more as an RN. Then once you are scheduled to take your NCLEX and you pass your NCLEX and you get your certification, then you can just transition into being a fully certified registered nurse and working in that role at your hospital, and then your pay will increase again. So the progression of most SNAP programs, you start as a PCT, then once you graduate, you get your ATT, your pay will go up, and then once you take your NCLEX and pass, your pay will go up again, and you will be a registered nurse working in that unit. Some hospitals will let you switch units and go to a different one, but that's a really good opportunity, especially if you join a SNAP program at your desired hospital to work as an RN, because you kind of can see yourself grow, and you can also see yourself increase your pay over the time, which is a nice benefit from the SNAP program. Although it can be challenging, I do think it's worth it because you gain invaluable experience that you can carry over into your career as an RN once you finish your nursing program. I think that the learning curve from when you graduate nursing school to when you start your first position as an RN on the hospital floor, that learning curve is going to be significant. You know, although they do teach us these topics in nursing school and all the things we need to know, and we do get clinical experience, it's really not the same as working independently as an RN. At least that's what I'm anticipating. But I do think that with my experience as a PCT, it's going to help set me up for more success and more of an easy transition compared to if I didn't get a job in the hospital as a PCT. I think that it's only going to help me feel more prepared as an RN, even though I'm sure I'm going to feel very unprepared at the same time because it's just a big transition and a lot more responsibility as an RN. Thank you guys for watching. I really appreciate all of you that are supporting my channel and helping me continue this adventure because it's very new to me, but I really do want to continue this channel and continue to provide you guys with educational content, all things nursing and health, and just to continue to share my knowledge and experience in the healthcare industry. If you found this video to be helpful or educational in any way, please give it a thumbs up. It really helps me out with my channel. Also, if you guys are interested, please subscribe and help me grow this channel. I plan to post weekly videos on all things nursing and life balance, as well as health education topics. So please follow along if you guys would like to be a part of it and join this community. I really look forward to what's to come, and I hope that I see you guys all in the next video. See you guys next week on Nurse Life Balance. With as well, but overall, hair in the lip gloss is never fun. For example, Graham, my cat. Okay, here we go again. So, final answer, I would say that prioritization is the number one reason. You're going to be assisting nurses with all of their tasks. Not all of them, but a lot of them. This is not easy. YouTube is hard.